Hi everyone and welcome back to the Chemist Couple podcast with your hosts Jess and Lee. We are both clinical pharmacists who currently work in GP practices in the northwest of England. The aim of our podcast is to provide evidence-based information so that our listeners are able to make better informed decisions about different complications to do with their health. So this week we're going to be discussing alcohol and it's the second in a mini-series that we've been doing, and this specific podcast is going to be about the acute and the chronic complications of alcohol consumption. So I think it's probably best if we start off by maybe stating some stats that we found when we were researching this to do with alcohol and its complications.
Yeah. So one of them is that they believe over 600,000 people in England are classed as dependent drinkers. There's a large proportion of them drinkers who are then classed as binge drinking, which we will go on to in terms of acute complications. And pardon me, there's a few things that have changed in terms of the accessibility to alcohol in terms of cost. So one of them was that it's 74% more affordable now than it was back in 1987. So there's no surprise that alcohol-related issues and problems are on the rise.
Yeah. So another stat that I found actually was that in 2022 there was 7,900 alcohol-specific deaths, which was an increase by 56% compared to 2006 in England specifically. So again, it shows that it's increasing and it's on the rise. Just to point out as well, where you were saying about the alcohol dependence, and the World Health Organization has actually put a stat out that there's approximately 209 million people who live with alcohol dependence worldwide, which is staggering, isn't it?
It is.
Yeah, it's huge.
And like our, I've got a sore throat today, so sorry. But like I said in the previous podcast, we are going to try and provide as much information in a holistic and unbiased point of view. But this episode is sort of specifying on the complications of alcohol. So it will have more of a negative outlook on it, but we are going to give why that may not be necessarily true.
Yeah.
And look behind the studies.
Yeah, and just to expand on that, we did say in the last one that by doing these podcasts, we know that alcohol and alcohol consumption can be a sensitive topic to people. We are by no means trying to make anybody feel bad about their relationship with alcohol. It's purely just giving you the advice or the guidance or the studies, like you say, that are out there so that you can make your own decisions about it. And that's definitely something that doing this podcast, I've seen a different light, and I think that some of the things that we've gone through and researched have made me think about alcohol in a different way, which has been good for me. And we will leave links to Alcohol UK, and then also some of the resources to help people who are struggling with alcohol in the description, should anybody need those. Yeah,
I think so. And a lot of the adverse effects associated with alcohol are related to the chronic complications. But like anything, everything does have an acute phase. So in terms of the acute phase and complications of alcohol, it's mainly implemented and comes about by the action on the prefrontal cortex, which we said last week.
Yeah.
And it's normally due to a lack of inhibition and the inability to operate machinery. That's a big thing.
Yeah.
And one thing I do want to touch upon is drink driving.
Yeah.
Now, I don't think there's any positivity that can be shown on this. I mean, back in 2021, 260 deaths were related to this and 6,400 plus casualties due to drink driving. The law's there for a reason. I know people will have different tolerances, and that's not something we're going to go into today because of receptor downregulation, etc. But the legal limit, in my opinion, you shouldn't consume alcohol if you are going to operate machinery, cars, in any capacity whatsoever.
Just obviously going on from that though, is one of the actual side effects or the effects of alcohol is that our risk processing is down-regulated. So people may think, oh, I'm fine to drive. However, because you've consumed alcohol, your ability to make those decisions is impaired. And so it should just be that I think, and this is what I have always practiced, is that if I have a drink, I am not driving. Even if it's one, I just don't do it because, like you say, it's the complications and things that can happen from drink driving. Like, there's so many deaths that occur from it. It's just not worth it. Even just having one, just don't drive.
Yeah, I think it's the most selfish act that anyone can perform.
Yeah.
But going on to that, like you just said, it's due to loss of inhibition and processing risk. There's some studies on, I think it was Alcohol UK. So, for example, back in 2016, 39% of crimes committed were due to people being under the influence, apparently. And
That's a really high number, isn't it?
It is.
Yeah.
And it was also one of the contributing factors why alcohol units were brought down for men, was due to just reckless behaviour and injuries.
Yeah.
Not so much the long-term complications, but the short-term, by drink driving and all these other offences.
Yeah, the effect on society that alcohol has is huge. You know, if you think about it, it's the most consumed drug that we have in society. And so, yeah, I think you had a stat about how much it costs the government or how much it costs the NHS about
I think it was £3.5 billion that it cost the
Yeah.
NHS. In terms of people being admitted, back in 2019 and 2020, just under 1 million hospital admissions were related to alcohol. But then, like we said, the guidance changed in 2016, and in terms of even the government have put out that there is no safe level for alcohol consumption.
Yeah.
So if they're saying that, that must be, there isn't really. They, in my opinion, it's still out there because of the financial incentives of it. So by the end of this year, I believe it's meant to be 12.7 billion in terms of tax accumulation from alcohol sales.
Mm-hmm.
Now, this is another thing where Scotland, Wales, Northern Ireland, I think are discussing it, but there's a minimum unit price for alcohol and it's going up. From what I've read, England don't have any plans to introduce that.
No.
So then if the health of the economy and all these other things were at public interest, for example, it would have been implemented at some level.
Yeah. I agree.
That's more political than
what
I wanted to go into. But
yeah.
yeah, a lot of the short-term effects of alcohol are related to lack of inhibition, processing.
Yeah, so your speech and language, you may recognise that people can slur the speech. Again, this is to do with the prefrontal cortex. Reasoning, so a lot of people may get into arguments and like it can affect relationships because your ability to reason and your ability to process risk and process what you're saying is impaired. You know, it actually is involved in personality expression. This is something that I wanted to point out, that we don't know how alcohol is going to affect, you know, everybody individually. And so sometimes you notice that if somebody drinks alcohol, they can become more aggressive, and you couldn't preempt that. And some, you know, it can also affect people different ways at different times. So, you know, it's all to do with very complex systems within the brain, but it is all to do with this prefrontal cortex. Another thing that I just wanted to point out was the effect on dopamine. So it's only recently been found out that alcohol does exert its effect on the dopaminergic pathway. So when we drink alcohol acutely, it does release dopamine. So dopamine is the reward center in the brain, and it makes us want to have more of whatever is producing the dopamine. You've probably heard at the moment where everybody's looking for cheap dopamine, where it's, you know, whether you're scrolling on Instagram, whether you're drinking, whether you're doing drugs, and so they all are part of this reward center. The government and also alcohol companies will state on their adverts or their campaigns to please drink responsibly. Now, that is very difficult in terms of if alcohol produces this dopamine response, your brain is then obviously telling you to then drink more of the thing that's giving you the dopamine high. So it's just to bear in mind that, you know, not that it's impossible and you can't just have one drink. It just means that when you drink alcohol, it does make it more difficult. And so people may you know, if you feel pressured into, just have one drink, if you feel like, you know, you can't stop and you do have more, just think about that it's not just you, it is also the chemicals that are going on with your brain that can produce this dopamine high.
It's an ironic tagline, isn't it?
It is, yeah. And it kind of, when I was looking into the research and, you know, doing this podcast and then linking it up with that, I found it quite sad because you're sort of setting people up to fail. You know, if you're saying that, you can have like a certain amount of alcohol per week, but just do it responsibly. And the fact that the way that it works is very difficult to do that, and especially in some, you know, patients or in, you know, in society. You know, I just don't think it's very fair. No,
I don't. And one thing that we learned over the weekend, so we went down to London.
Mm-hmm, yeah.
We done a Jack the Ripper tour around Whitechapel. And apparently back in 1888, when he was prolific and committed the 5 murders, there was a term called the hangover. Yeah. And it was due to sort of the housing accommodation back in the day. You could either pay for, I think it was 4p a night for basically a wood slatted bed, wasn't it? And you'd swap the mattress over for the different times a day, wasn't it? Yeah. And then if you didn't have that much money, it was 2p to literally sleep hanging over a rope. Yeah. And the reason behind that wasn't due to financial inadequacies, it was because gin was freely available from the pub, so you'd rather spend that extra 2p, 3p on gin, and then you'd hang over the rope.
And it also was to do with the fact that if you think about alcohol and how it exerts effect again, it can cause unconsciousness, and so people will tend to be sleepy when they've had alcohol. It can also affect your gag reflex, so people can asphyxiate on like choking on their own vomit, and so if you're hanging over a rope, it reduced the risk of people dying from asphyxiation. So that was another reason why people would have chose to sleep over the rope, which I thought it was so interesting.
It was weird, wasn't it?
Yeah.
How it just come up.
But then that leads us on to another acute effect of alcohol, which is, you know, what everyone knows is the hangover, and the awful feeling that you get when you wake up the next day after drinking alcohol. So, you know, mainly to do with the fact that alcohol is converted to acetaldehyde, which is toxic to every cell in your body, and so it does make you feel nauseous, you can get vomiting, you get a headache, flushing. We also discussed in the last podcast that alcohol is a dehydrator. Well, I think it's a dehydrator. It's a diuretic, basically. So that coupled with a build-up of acetaldehyde, you know, you can feel really pretty ill the next day.
You can. And that leads us on to chronic complications now. So in terms of the hangover, we haven't found a cure yet. There's all minerals, vitamins that they're trying to do, but it's not quenching the saturation of the metabolism enough. Mm-hmm. But in terms of chronic complications, I want to start with the brain.
Okay.
Where it mainly exerts its effects.
Yeah.
Now, we did look at a study on cognitive decline, and this was done over 30 years. Pardon me. And it was over 500 people, mainly men, middle class. And they measured what was classed as, well, it was based on a questionnaire to see how much they drank, and they followed them up at 5-year intervals. Mm-hmm. And they performed MRIs. They also done lexical fluency and semantic fluency tests to see.
I didn't know what this was
I didn't. So lexical is where you are asked to name something with the same letter. So how many cars can you name with the letter C within a minute? And then semantic is where you say, okay, can you name any car? And you get a minute again. Yeah. And their hypothesis was that lexical fluency would decline with time, and semantic didn't really change. And that's exactly what happened over the 30 years. So they found that there was a 14 to 17% decrease in cognitive function through lexical fluency, and your hippocampal volume atrophied. So the hippocampus, for anyone who doesn't know, is mainly involved in conversion of memories to long term. Yeah. You've got learning, other developmental processes within the body. It's quite an important part. I think hippocampus stands for horse, like a seahorse in Greek. Yeah. And because if you actually look at it anatomically, it does look like a seahorse. But yeah, it's involved in a lot of learning and daily activities.
I was going to say, just going back to that as well, that's how you can get blackouts, you know, acutely from alcohol, because it affects the conversion of short-term memory from your prefrontal cortex.
It's hard to say.
Yeah, to convert it into long-term memory. And so, again, that might be why people wake up and get anxiety, because you can't remember what you did the night before. That, you know, but yeah, sorry, that was like going back a bit.
No, it's all relevant, isn't it?
Yeah, it's so... Alcohol and its effects they affect every system within the body. So we'll obviously try and go through as many as we can in this podcast, but there's probably going to be things that we will miss out. But again, like obviously the podcasts are there just for a reference, so that you can go away and like research anything that you want to from it. But yeah, sorry, carry on.
Yeah. And like we will say and we'll allude to throughout the whole of this podcast, alcohol studies are quite hard to assess because a lot of it is based upon patient compliance in terms of reporting. Mm-hmm. Now, in this study, I think it was average 60% of those reported all the time. So that 40%, there was an absence of results. So it's sort of extrapolated. Mm-hmm. There's a bit of gap filling. And again, our podcasts are there to basically uncensor all the information. So we're going to include this study. So this was in the BMJ. We're going to let you look at it and interpret it from your own point of view. But for example, why this has a weakness, this study, is because people who were classed as abstainers, so the control group basically, they were classed as those who drank less than 1 unit per week. So by definition, you could technically drink just under 4 shots of vodka in a month. Mm-hmm. So it's not truly abstinent. Again, we don't know how long they've drank for less than 1 unit a week. Again, these are all things that you need to take into account when you do interpret studies, and that, again, like we said, it's middle-aged, middle-class men. This doesn't apply to women, or potentially couldn't apply to women, couldn't apply to working class individuals.
Yeah.
But I just wanted to bring this to, well, everyone's attention, because it was stark in terms of the cognitive decline that you was observing over that time.
Yeah.
And the MRI evidence at the same time, or the grey matter. But yeah, that was stark, that study.
Yeah. So then the next one that can affect the brain is Wernicke's encephalopathy, which is to do with a thiamine deficiency. So if you or you know of anyone who's drinking heavily, sometimes your GP or the hospital will put a patient on thiamine tablets, mainly due to the fact that we get thiamine from our diet. So it's a cofactor, which is involved, it's a vitamin, but it's also involved in enzymatic reactions throughout the body, and it's heavily involved in brain activity. So we need it to be able to basically do metabolic functions within the brain. If patients who tend to drink heavily, the diet tends to be poor, and so they're not getting enough thiamine from the diet in order to, for the amount needed to be able to carry out these basic functions. Also, which we'll go on to, alcohol directly affects the liver. The liver is what converts the thiamine that we absorb from the diet into the active form to be able to be used. And so if your liver is damaged or it's affected, it doesn't do this as effectively. So basically it leads to this thiamine deficiency. And then if we have thiamine deficiency, which is severe enough, it will lead to Wernicke's encephalopathy, which is a brain disorder which causes confusion, ataxia, which is like muscle rigidity or just
loss of muscle control.
Yeah, loss of muscle control. And then it can also lead to death, can't it?
It can, and it also consists of ophthalmoplegia.
Yeah.
Which is a lack of coordination of your eyes. So it's normally nystagmus, which is basically rapid movement side to side. But yeah, it's life-threatening. Yeah. As a condition, we treat it with IV vitamins, which is IV Pabrinex. Yeah. But yeah, like you said, a lot of the thiamine deficiency comes from the lack of nutritional density from a diet, because it's already quenched by alcohol. Yeah. Which are classed as you've probably heard, empty calories. Yeah. Before. But yeah, that's a serious one. And then we go into the liver. Yeah, so the liver is probably the one that you associate most with alcohol complications, and it's because it's involved in the metabolism of alcohol. So like we were saying in the last podcast, so alcohol is converted to acetaldehyde, which is it's directly poisonous or toxic to all cells in the body, including liver cells. Yeah. Yeah. And then that's further converted to acetate, which is used in metabolic actions throughout the body. And like you said, the liver is implemented in a lot of the functions and metabolism of alcohol, and it can go through basically a disease progression. So it goes to something called steatosis, fatty liver, you get steatohepatitis, you get fibrosis, and then eventually cirrhosis, which a lot of people are aware of. It's irreversible damage to the liver. And then, if you continue to drink alcohol, this is why alcohol abstinence is like the best thing for, treatment of these things, is because it will then like sort of halt the process. Yeah. Whereas if you just keep on drinking alcohol, it just damages more and more of your liver cells, and then it gets irreversible then to a point where you just can't, it can't go back. Yeah, so I'm going to go into a bit more of how it causes the pathogenesis of liver dysfunction, etc. Because it's one thing saying, it causes this, but people like to know, don't they? So like we said last time, 75% of alcohol is converted to acetaldehyde via alcohol dehydrogenase. The other 25%, once that's saturated, which is normally in chronic users of alcohol or even binge drinking to high levels, is via oxidative enzymes, basically. So you've got cytochrome P450 enzymes, the main one being CYP2E1. Now, when that's metabolizing alcohol, it does create oxygen-free radicals. So you've heard of antioxidants. Yeah, these are supposed to quench them. Yeah, and the concern with oxidative free radicals are that it can damage organelles, so mitochondrial all these little power plants within the cell. Yeah. And then it causes the stress response within the cell. Now, that's one of the reasons, is that it can cause that to liver cells, and that will trigger inflammation within them. Now, you've also got the way that fat metabolism and generation within the liver occurs during alcohol metabolism. Yeah. Now, a lot of this is due to when you convert alcohol to the intermediary, it converts NAD, which we said last time, plus to NADH. When the body has higher levels of NADH, that favours lipogenesis, so the formation of fats within the liver cell, and prevents them from being broken down because you need the opposite part to do all them processes. So when you've got oxidative stress, then you've got increased fat, which will then change the formation of the cell, increasing more stress. You get an inflammatory reaction, basically, which then will eventually lead to fibrosis. Well, hepatitis, then fibrosis, then cirrhosis, if you do it enough.
And hepatitis is just inflammation of the liver cells.
Yeah. And as a rule of thumb, anything with itis on the end is inflammation of whatever is before it. So that's a big thing. And then when I'm going to touch upon the microbiome, because alcohol can directly irritate the microbiome. It also changes I would say the structure of it, but it doesn't. It changes the expression of certain bacteria within it. And it's now thought that the actual microbiome of someone who drinks a lot is pathogenic in its own right. And this was suspected when they got a mouse study of alcoholic-related liver disease. They put someone who had a healthy microbiome into it, and they got someone who had alcoholic hepatitis. Tongue twisters, aren't they, to say it all at once, and put them into it. And the one with the healthy microbiome didn't increase toxicity, whereas the hepatitis did. So, and one of the reasons why they believe that is because it it makes a lot of enzymes called proteolytic enzymes, and they basically break down the barriers from the intestine into the body. So it allows bacteria to just basically walk on through.
And then another thing to point out why that's so important is because your liver has got a direct blood supply from your intestine. So anything that we absorb through the intestine will go straight to your liver. And these bacteria, again, are they exert inflammatory responses on the cells. So it is basically just pro-inflammatory, just causing inflammation in your liver, which leads to scarring, the fibrosis, and then ultimately will lead to cirrhosis. So that is important.
And the liver is well equipped. It does have its own supply of immune cells called Kupffer cells, and they're within the lobules of the liver because they're the functional units. But it does become saturated, and it comes to a point where its tolerance is just no longer there. But then we go on to, so besides all this, if you get cirrhosis, which is the main one that you don't want to get, it's awful. It basically stops your body from making clotting factors, stops it from metabolizing a lot of medication. You can get ascites, which is accumulation of fluid within your abdomen. That's because you don't make proteins in your blood, such as albumin. All these complications, and the biggest one that we treat on a regular basis from hospital is when you've got cirrhosis, it causes a backflow of blood. Now, like Jess said, all these intestines, so you've got your intestines, your stomach, your spleen, all feed into the liver. And that's why the liver is so unique, because it gets blood from the heart and gets it from the digestive system. And once it goes into here, it gets filtered, blah, 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 and goes to the inferior vena cava and goes into the heart. If you've got a backflow of blood, it puts pressure on certain parts of the digestive system, the main one being the esophageal vasculature, and you get something called varices. I feel like I need to let you talk because I'm just going off and on.
Like you say, varices are just really the blood vessels within your esophagus that become very, very large. And the issue with that is that if they are more prone to bleeding, and so you'll get basically just patients will bleed from internally.
And it's a lot of blood.
We used to work in the hospital. We worked on the gastro wards. Part of my pre-reg, I seen a procedure for to treat these varices, and it's basically where they put a camera down your esophagus and band them with literally elastic bands to stop the blood, just coming out. And it's so sad. Like, these patients may be going in, once, twice a week. It could be, twice a month, but the point is that it really can affect someone's life, if they happen to come in for banding so often. We can use things like beta blockers, can't we, which constrict your blood vessels to hopefully prevent the varices from getting any worse. But like you say, it's just this build-up of blood that will cause the blood vessels to burst and then cause, vomiting of blood, things like that.
So looking at the liver as a whole, it can progress to cirrhosis, which is the worst case scenario. A lot of people think, well, surely if I'm binge drinking or I only have a few drinks of a weekend, that won't be me. Binge drinking is probably worse because it produces high levels of alcohol acutely. But also, like anything in medicine, everyone has their own personal threshold. I do want to make that clear that we're not trying to scaremonger anyone. It's just being conscious of the decisions you're taking. At the end of the day, everyone has autonomy to do what they want within reason.
Yeah.
And your threshold could be a lot lower than someone who's a chronic alcoholic. And there is evidence out there that those who do drink lower amounts but on a regular basis do adapt the enzymatic functions within the liver and all other processes, down regulation of receptors, which is why you can get terms such as functioning alcoholics. And one thing that I've done poorly throughout this podcast is called alcohol liver disease. Now, the new terms are alcohol associated, and it's to reduce the stigma of alcohol. And going on to the stigma of alcohol, a bit of a sidetrack, is that when we do consultations, etc., it's still hard to ask someone how much they drink and all these things. And I think it's purely because if it's available in the capacity that it is, it surely can't be a bad thing. So a lot of people don't draw that sort of connection between them. So it does become a hard thing. Whereas smoking's become a bit easier now because of the 2006 Health Act, where we can't smoke indoors, and there's all these different bans. You can't smoke in a car with a child under the age of 18. All these laws are coming in for smoking, but not so much alcohol.
Yeah, I know, and I think that's also why we wanted to do this podcast, because not many people are really talking about it, or like it's very difficult to talk about, because like we said at the beginning of the podcast, there is a stigma associated with alcohol because it's so readily available. But obviously, like we've discussed in some of the statistics that we've gone through, it is still becoming, it is more of a problem now than it was, say, 20 years ago. And so there is something that's not going correctly in terms of a health professional point of view. We need to be talking about it more. And, just doing what we're trying to do in this podcast is just making patients aware so that they're able to make their own decision. We're not going to judge anyone in whatever path they choose to take. It's just that if you don't know what the information is, or you don't know the complications of alcohol, how are you supposed to make an informed decision? And like I also said at the beginning of the podcast, from doing this, it sort of changed my outlook on alcohol. Not that I drink, I'm not dependent on alcohol. I don't really drink that much, not compared to what I used to anyway. I only drink in social settings. But I think, going forward now, I think I'd be more mindful to think, well, actually, do I really want to drink tonight?
Which is good.
Yeah,
but
it is.
If you do look at it from a patient's point of view, or anyone who uses alcohol in the public, back in the 80s, this is a debate that I always have with my dad, is that they used to have Sunday hours in a pub. So I can't think of them, but it'd be 1 till 3 you drink, and then it closes until I think 6 o'clock, and then you have 6 till 9, whatever it was, so everyone could go home after dinner and all them things. Now, if alcohol is such a bad thing, why have we then removed all these barriers on it and allowed 24-hour drinking? There are places in town, in Liverpool, where you could, I don't know about now, but certainly a couple of years ago, you could go and drink 24 hours a day. If you think of big pubs, big chains, I'm not going to name any, but you can go from 8 in the morning and buy an alcoholic drink. My argument against that was, if you're a night worker or you work long hours and you wanted a drink and your shift finished at, 5 in the morning, you should have that right to go and have that. But again, it's quite hard to impact people's lives if the government and all these restrictions are being lifted.
Oh yeah. I also wanted this, just before we probably wrap up the podcast, the charity run Dry January. So at the end of 2023, they did a study. It was 2,000 people, so it wasn't it wasn't a study actually, it was just a survey, so it wasn't a huge survey. But from that survey, it revealed that 30% of men and 26% of women actually wanted to actively reduce their alcohol intake in 2024. So which is good. So 23% of adults who were surveyed said that they drank so that they become more sociable. Now, as humans, we want to be sociable. We are sociable animals, but a lot of people feel like they can't socialise without alcohol. Definitely something that I've struggled with. I felt like, certain things that happen in your life, your confidence gets knocked, and with alcohol, you do feel like, oh, okay, I'm more confident, because you do lose your inhibition.
You do.
But that was, 23% is a huge amount of people that they're using it just purely to be in a social situation. And I think, something that I've learned by doing this podcast actually is that it's just built my confidence up to be able to be in social situations without the need for anything, which has been positive for me. And so, again, just something for people to be mindful of, that there are other ways to increase your confidence than using, you know, things. And then the last thing was that 21% said that they drank due to financial pressures or, you know, the cost of living crisis, which we had last year. And again, you know, it's sad because at the same time, you know, alcohol decreases your productivity. So, you know,
increases
if you drink,
your outlay in terms
your
of
outlay.
costs.
And so, yeah, it's again, you know, just sort of a, something, it's, you know, it's a way of an escape for people, isn't it?
But that's been in society for years.
Exactly.
And when we done that walkabout tour the other day, even in the 1800s in Whitechapel, it was known as London's dirty little secret. And it's because of the levels of poverty, etc. And everyone would spend whatever money they had on just drowning the sorrows, basically, because they didn't want to face reality. And that's still more applicable than ever today, isn't it?
Yeah.
And then, well, whilst you're talking about people who want to quit, a good time to quit or prevent drinking anymore is during pregnancy.
Yes.
That is one thing. So there is something called fetal alcoholic syndrome. Now, its prevalence is 30% in those who are born to alcoholic mothers. In general, it's about 3 in 1,000 births. But the idea was that you should stop drinking during pregnancy because it can reduce birth weight, it can increase
fetal alcohol syndrome.
Then you've also got cognitive impairment or learning disabilities within the child.
Yeah, that's part of fetal alcohol syndrome as well.
And facial abnormalities.
Yeah.
But a lot of these, so there's no agreed time in terms of what point should you stop drinking to prevent these risks. So I believe up to 4 weeks was when facial abnormalities were seen in fetal alcoholic syndrome, and up to 10 weeks the neurological impacts were seen. But now the studies are going back further to say that just prior to becoming pregnant is just as important as stopping drinking during pregnancy. Definitely
something that I would like to maybe elaborate on in a further podcast, because it was something that was interesting to me at the moment. You know, I'm 30, I won't be having kids anytime soon, but hopefully in the next couple of years, you know, I will start to be thinking about it, and I definitely would love to know, you know, what are the guidelines, what do the studies suggest? Because again, it's just something that, you know, it would be interesting probably to a lot of our listeners.
Yeah, and that's also a point I wanted to make, is that studies and evidence around this subject will be few and far between, because there's only a set amount of cohorts that you can study.
Yeah.
And pregnancy is an ethical
it's very difficult
problem, and you couldn't really give certain patients a set amount of alcohol, those not, because then if anything did happen. So that is one thing. Now, before we finish the podcast, I did want to go over the main take-home points, because we've went through a lot of science, studies, numbers.
Yeah.
What is it practically that you can take home from this? So from the studies with alcohol, it's all relating to how patients report it, and basically there's not enough studies in terms of having a true control. A lot of studies tend to have abstinence either due to health ill effects. Then you've got abstinence classed as still drinking, but it's less than a certain amount per week. There's no time duration set specifically. So in terms of taking one study and comparing it against another, it's hard to do that. And we are going to do a podcast in the future on how we interpret our evidence. We leave the evidence there for you to interpret yourself, because that's the good thing about science. You can draw many conclusions from one set of results, but we're going to go through how we critically appraise certain things. But in terms of your brain function and chronic complications, there is apparently at the moment an association between drinking more and it is dose dependent. The more you drink, there's a higher risk of having cognitive impairment and decline, mainly due to its actions on the prefrontal cortex, hard to say, and hippocampal volume. So one thing is, if you want to have a better relationship and reduce your chance, because there is links with Alzheimer's, there's nothing there categorically yet, but from what I've read. But if you want to reduce them chances, by all means, don't drink as much. And this was still seen in moderate and light drinkers, so 7 to 14 units, 14 to 21, which was the old guidelines. So take that into account. A lot of these are mainly found in men as well. So a lot of men tend to drink a lot more than women. And they were more likely studied. I think there was a lot of the findings didn't actually occur within the women. And that could be due to a few things, whether the MRIs were accurate, etc.
Yeah.
Now going to the liver. the liver's metabolizes alcohol. It's where a lot of the effects do take place and are detoxified. Again, a lot of excessive drinkers will have fat already. 90% of them will have fat within the liver. If you want to reduce this or reverse it, you can do before it gets too late, which is cirrhosis. The best way is abstinence, and true abstinence, meaning do not drink at all. Those who have been on it for a long time, do not stop, because you will have withdrawal effects. And anything that we've said in this podcast, I forgot to say at the beginning, is our own opinion. It's for advice and should not be seen or used in substitute to seeing a healthcare professional. But yeah, so in terms of the effects on your liver, try and reduce your intake or reduce it altogether. Stop it altogether, I mean. Microbiome, new science, it is going to affect it. Alcohol is used to sanitize anyway. It's used to sterilize areas. So what's it going to do to the bacteria in your gut? It's going to do the same thing. So if you want to improve your function of your microbiome, which is involved in a plethora of systems within the body, try to reduce your alcohol intake again. Pregnancy, just don't drink. Really don't drink. It's another selfish act in terms of you're not just impacting your own health, it's your unborn baby's health, and then they could have a catalogue of errors going on from there, and they could develop some sort of dependency from that point. And
I think just from my point of view, I just wanted to say practically, we said this the other day, and I said I wanted to discuss it, that a lot of people may feel pressured into drinking, and so if you're in a social situation where all of the people that you're with are drinking and you're not, it can be a point of conversation as, well, why aren't you drinking? And you get a lot of questions, and then you can feel pressured into doing it. If I was to give one piece of advice to anyone listening to this, is that next time you're in a social situation and somebody isn't drinking, just don't say anything and just leave it, because by prompting someone or pushing someone into asking them, it might make them then want to drink when they didn't want to in the first place, and it just makes it easier for people to then abstain from drink if that's what they want to do. So yeah, I would just say just be more mindful of if people don't want to drink, just don't make a big deal of it. Just let it go. I know that it's made a big deal, when you stop drinking, and it was always, well, why aren't you drinking? So that would be my advice, the one thing to take from it. And then also, like everything, just weigh up your own risk benefit. If you accept the risk that we've discussed and you don't mind getting any of the conditions, then by all means, go and drink. But if you feel like, oh yeah, actually I wouldn't really mind, I wouldn't like getting that, or, and as with all of these things as well, genetically you may be predisposed to developing these at an earlier stage, drinking less alcohol, you just don't know. So definitely think about that as well. Yeah, and also as a future-proofing thing, the evidence that we've done today is accurate of today. Yeah. Science is an evolving practice. It could change in 10 years' time that light drinking is beneficial. And that leads us on to our next podcast, which are going to be the benefits. And this one, like I said at the beginning, that it might have come across negative, biased towards, I don't want to drink, but you still drink. So that's why it's not biased in my opinion, because we're given two viewpoints. Yeah. But next week we are going to discuss, are there any uses to alcohol? Does it have any benefits? And if so, in what quantities, and how should you use it if you are going to use it? But as always, thanks for listening, and we will see you next time.